Premature birth remains one of the leading causes of neonatal complications. Many patients are considered low risk based on traditional screening tools. The PRIME study asks an important question: can we better identify hidden preterm risk earlier in pregnancy? Study participants at St. David's Women's Center of Texas and other trial sites underwent a blood draw between 18 and 21 weeks of pregnancy to assess their risk of spontaneous premature birth using a maternal biomarker test. Those identified as higher risk received a care regimen that included daily progesterone, low-dose aspirin, and weekly nurse check-ins, in addition to standard prenatal care. You can start out a pregnancy as being a low-risk patient, and then suddenly everything can change for you. And the goal was to give us another tool to help predict preterm birth, because it is an incredible problem that we encounter in the obstetric world. And our current tools that are used to predict preterm birth miss the majority of women who are at risk. In Samantha's case, we would not have had any idea that there was perhaps risk. We wouldn't have had a reason to monitor more closely or to start these interventions, and therefore we might have been dealing with a very different outcome: a much earlier baby, a longer NICU stay, and a much different experience for mom.
I think it's hard to know with a predictive study what role it could play, because you don't know what would have happened if you didn't take the interventions. But I like to think that because we were in the study and we knew and we were doing the protocol, that gave us a sense of reassurance that we were doing everything that we possibly could in order to ensure that we were going to have a safe pregnancy. We were getting the monitoring, so we knew that we were going to be able to catch anything early enough and have the proper interventions if we needed.
We can see from this study that Samantha ended up doing better in terms of outcomes than women who were high risk but who didn't know and didn't ultimately receive the intervention.
It was really nice to have an opportunity to participate in something that could further all of that knowledge and education around staying pregnant and having healthy babies. And just knowing that we were in a place that provided such a high level of care for both prenatal and postnatal care was really important to us. And so having all of that come together actually was a really cool opportunity for us, and something that we really enjoyed and made us feel really good coming out of the end of the journey.
Every pregnancy journey is different, but at St. David's Women's Center of Texas, we're prepared for any pregnancy that comes our way, because at St. David's Healthcare, the best is here.